We have quite a clear clinical governance framework that we follow for cataract surgery here at Newmedica. Quite lucky because there's such a large group of us. We have lots of experienced clinicians who can help take an active part in this. We make sure we follow national policies, for example, the Getting It Right First Time policy for cataract surgery, to make sure that we're aligned with national standards. And we also follow the guidance from the Royal College of Ophthalmologists to look at what the national outcome should be. So I feel like we're providing an excellent service for our patients throughout the country, and I feel quite proud of that fact. Safety checks are the most important thing that we look at here when we're doing any surgery, but in particular in cataract surgery. There's very clear WHO checklist that we follow to make sure that each patient receives the best care possible. This includes running through their comorbidities, their allergies, any particular difficulties we may have during the surgery, any particular equipment we may need, and most importantly, making sure that we've all double checked what lens we're going to use, including using the right formula and visual outcome for that patient. There's quite a big focus on making sure that we share adverse events. Our teams are quite pushed quite clearly to make sure that they report any adverse incidents, to make sure that as a group we can learn and make sure we're continuing to provide the best care for our patients. We're quite lucky here in Newmedica, as nationally our complication rate is quite low, but if things do go wrong, we make sure that we don't just leave the patient hanging. It's quite clear, we have a clear approach to how we manage these situations. They're all led by consultants, usually involving multiple consultant reviews, and making sure that we're walking that patient through the journey that they're having, to explain that it may not have been as straightforward as we'd planned, and explain why that may have occurred, so that the patient's following us on that journey to get to their visual goal.